So my name is Raj Keswani. I'm the Director of Quality and Director of Endoscopy at the Digestive Health Center at Northwestern Medicine.
I'm John Pandolfino. I'm the Division Chief of Gastroenterology and Hepatology at Northwestern Medicine.
I think all of us kind of understand what artificial intelligence is just from our daily lives right now, but what it essentially means is developed algorithms. We develop algorithms these computers can utilize to mimic what human intelligence is like. AI has really crept into medicine quite dramatically over the past 5 to 10 years. And I like to think of it in two broad categories. One is data that is just sort of electronic health record data that's very difficult to sift through, all the lab values, all the reports. And there's a lot of advancements in artificial intelligence and how we can synthesize that data to help us deliver better patient care. We're developing artificial intelligence algorithms that help us do it and figure out when a patient may be at risk for cancer or when a patient may be getting sicker. The other broad category is something called computer vision. How we can look at pictures, either x-rays, CT scans, or in our case, endoscopic videos. We're doing procedures that are minutes to hours long sometimes, and each of those frames of video has a lot of data about the patient. And the question is, how do we interpret that data and how do we utilize it? It's far too much for one human to sift through, but we know that computers can actually look at these entire videos and learn what to do about a patient care based on those videos. I think some of the areas that people are most interested in is how do we make endoscopy a higher quality exam overall. For example, in inflammatory bowel disease, it's difficult to assess how severe the inflammation is, and we think that artificial intelligence can help us do better. And there's a lot of people working on this, and we're trying to contribute to that area as well. How do we assess the degree of inflammation, and how do we make sure the patients are getting the right treatment? In colonoscopy, trying to find polyps and trying to do a good exam to prevent colon cancer is really paramount. And we're working with artificial intelligence and understand how it can help us teach people how to do colonoscopy better.
Northwestern has been involved in artificial intelligence for many years now. We've actually developed a program called Artificial Intelligence and Mathematics in GI, AIMG. And this really was started when we had an NIH grant that was really focused on high-level mathematics and engineering in studying human physiology. And over the years, we've created some of the simple algorithms that everybody's using in academic medical centers across the country to study diagnostics in terms of esophageal motility. We've also gone further and used machine learning to better stratify risk for procedures, and then also how the patients would do after a specific intervention. This has now evolved even further, where we have developed these convoluted neural networks, a way where the machine actually thinks on its own and can make a diagnosis in a very different way than a human, but very accurately. And now, really where we're going in the future is virtual organs. We've actually used artificial intelligence to create virtual organs, and instead of doing research on humans and animals, we can actually test our hypotheses on these organs and see what the outcomes are. So we've been publishing in the world of AI for many years, and probably the first introduction into that was the Chicago classification, which were simple algorithms in a tree design that's now being utilized in most motility equipment around the country. We then kind of moved on to other publications where we cited our work in machine learning in journals like Neurogastroenterology and Motility and various AI journals, where now we actually have the ability to augment people's ability to diagnose diseases.
I think it's important as we get inundated with AI products over the next 5 to 10 years is to understand, are those products applicable to our population? We need to be looking out for any biases. Does it make our clinicians better? Does it make us more efficient, able to deliver better care? And similarly, when we're developing products, we need to really make sure that when we try to broaden this and allow other people to use it around the country, that we're actually learning from this implementation to make our products better.
One of the important things with artificial intelligence is when you're actually developing these algorithms or these convoluted neural networks, is that you're actually validating it with data and then testing it again with an external data set. One of the unique things we have at Northwestern is we actually have collaboration with the engineering school at the university, and we also have exceptional data and categorization at the hospital. So when you bring those two things together, then you can really create the next generation of artificial intelligence technology. So in terms of the future, over the short-term period, I think really what we're going to see is an augmentation of the technology and intelligence, in that it's not going to replace the physician in terms of the crucial stuff that we do, but it's going to make us better. In the long term, I think what you're going to really see is this hybrid technology, where you're going to start to see us be able to develop techniques where we can actually predict things using these artificial organs and artificial systems. And I think that's going to be the next generation.